Good evening, everyone. My name is Scott Allardyce, and I am the founder of an organization called the Canadian Disability Alliance. You can find us on Facebook. Uh, the purpose of this organization is to support people with disabilities and in a number of ways employment, housing, healthcare, general advocacy, supports that people with disabilities from time to time need. Um, a couple of issues have been bothering me for a while. I try within the group that I just mentioned, the Canadian Disability Alliance, to address some of these issues and work with advocates in the disabled realm from across the country in order to address these issues and to reach out to various governments across the country to try to get our positions and our policy desires met. So, a couple of issues, starting off with the fact that the federal government has not appointed a minister responsible for disability issues. Now, I know that there is a person been assigned to look at these issues on behalf of the federal government. The difficulty is that this individual, although an MP, is not a minister, and therefore the power this person has to affect change on a whole host of issues, including things like employment, social services, healthcare, housing, access to communities through the built environment. At the federal level, transportation are all somewhat weakened because they're not actually sitting around the cabinet table. Being at the cabinet table or having a voice at the cabinet table would be helpful because oftentimes, and I've been an advocate for people with disabilities for, I would say, probably 40 years. And I can tell you that if you're not at the cabinet table being represented, it is difficult to persuade cabinet to consider other issues once a decision has already been made or formulated by that body. So the idea is if we have somebody who is at least aware of our concerns and can bring them up accordingly when the discussion might lead in that direction, and to express the views of people with disabilities when the discussion needs to happen would be helpful. And unfortunately, without a voice, it is difficult for organizations like the one that I represent to actually, make any headway. The other issue that I want to bring up, or the next issue, I should say, that I want to bring up is that there's been a number of people online who have been arguing with me regarding the impact of COVID-19 on the disabled community. The research would indicate, and this is taken from the Canadian Health Agency and other health professionals, that the impact of COVID was 6 to 7 times greater in the disabled community than it was in the larger community as a whole, meaning that people with disabilities were 6 to 7 times more likely to get very ill or 6 or 7 more times likely to die due to COVID. And one of the things that I've been arguing is that I would never force anybody to get a vaccine if they didn't want to, obviously, because I don't want to live in a society where people are forced to inject their bodies with anything that they don't believe in. But I want people to realize that their decision not to get vaccinated, or their decision not to wear masks or socially distance during the last pandemic and possibly future pandemics, will have consequences on those of us who are more vulnerable to similar diseases in the future. And that you just can't say that it's, my body, my choice when your choices impact others. Nobody wanted uh, Canada or the rest of the world for that matter to shut down in the way that it did. Nobody wanted to be home from, friends, from even work for the time period that people were. Nobody wanted to be told what to do. Everybody who lives in a free society wants the ability to have that freedom. But when you also have a global pandemic, which is killing people or making people very ill, having these social rules in place and these vaccines provided to people with the hope that they would take them and the hope that they would use social distancing policy like wearing a mask in public or not going out if you're not well or limiting your social contact was very beneficial to people with disabilities because we were more greatly impacted by the constraints of COVID, and arguing with these people that say they don't care if they infect other people is very exhausting. Because if you want to have a society where you have freedom, you also have to take, in my mind, responsibility for your choices. And so all I would ask people is that if the vaccine helps save lives and helps save the lives of the most vulnerable people in our society, don't you think it would be prudent to take that vaccine? And I think it would be. And I've been vaccinated 6 times. Uh, you know, and the only side effect that I ever had was after my third COVID shot. My arm hurt for 24 hours, and then I woke up the next day and I was fine. And I know some people will say that they've heard of people who have had greater side effects, or they've heard of people who've gotten sick, that they believe it's from the vaccine. Fair enough. I have not heard from a reliable source that anybody has died from taking a vaccine for COVID-19. So if there is actual evidence that that occurred, please share it because I would like to see it as long as it is a legitimate source, meaning from a medical journal or a medical professional who's actually documented it, then that's fine, but I haven't seen anything. And I am a former researcher. And I guess the other issue is that I want to talk to you about what it's like in Canada to be a person with a disability in general. Now, you're probably thinking that I'm going to complain, and I'm not going to complain all that much because I love being Canadian. And if I'm going to be a disabled person, there is no other country that I'd like to live in other than Canada. There are, I'm sure, very good countries that treat disabled people really well. But I must admit that being a Canadian with a disability, I've had more good days than I've had bad days. Now, I've had some bad days, and everybody has bad days. Even if you're not disabled, you can have a bad day. When I worked for the Ontario government, I worked for over 11,000 days over the course of my 32-year career. And I can tell you I had 7 bad days while employed in the Ontario government. And I must admit, I had 400 to 500 really good days. And the rest of my days were just typical days where nothing good or bad happened. They were just typical days at the office. But I can tell you that only having 7 really bad days, that's a pretty good bargain. And those 7 days all related to comments that people made, either former colleagues or former bosses, in regards to my disability or their lack of understanding about disability issues or their dismissal of my skills and abilities. as a policy professional because I thought that people with disabilities couldn't do the job, or I, as a person with a disability, couldn't do the job. And I didn't have a perfect career. I'm not the best policy professional in the world, and I realize that. But I'm certainly not the worst. And I certainly went into my work every day with the hope of being the best policy person I could be. And the last thing I'm going to say is that if you have concerns or questions regarding disability issues, or if you have, I guess, theories or misunderstandings, or not really sure about how to approach somebody with a disability, I can't speak for everybody with a disability. I can speak for myself, and I think I can also say many people with disabilities would say the same thing that I'm going to say to you now. It's okay to come and talk to us. It's okay to ask questions. It's okay to express your fears or concerns. The, I have multiple disabilities. My primary disability is that I have something called cerebral palsy. It affects largely the fact that I need to walk with two canes. I'm 60 years old now, and I'm still able to walk, although I need to do it with the two canes. I do use a wheelchair from time to time, but not that often. I try my best to keep my mobility because my feeling is, and I've talked to doctors about this, that if you stop your mobility, it is very difficult to regain your mobility. And I don't want to be in a wheelchair before I have to be. And it's okay to come and talk to us. It's okay to question us. It's okay to express your fears about disability, at least to me. And I'm not going to bite your head off or get upset or think that you're discriminatory or you're a bad person, because it's okay to have these feelings and it's okay to ask questions. And I want you to know that most people with disabilities are fine letting you know that even though they have a disability, they also have a life outside of being a person with a disability. For an example, I have a daughter who's able bodied, and she's not adopted. She's actually my flesh and blood. Now, she's 19 and she's going to university right now, and she's taking political science, exactly what I took as an undergrad as well. So I'm thrilled and honored that she wants to do something similar that I did, and I know that she'll do a fabulous job working in public policy if that's the direction she wants to go in eventually. Um, and I'm proud of her. And so, being a father with a disability is a little difficult sometimes, but I wouldn't change it for the world. And even though I'm a single dad, I still want to be there for my daughter as much as I can, and I want her to grow up. Even though she's an adult now, she still, in my mind, has some growing up to do, as everybody does. And I haven't finished my own journey in terms of growing. Um, and so I think it's important to realize that everyone has a story outside of the labels that we decide to put people under. So just remember that there are layers to everybody. And the very last thing I'm going to say before I let you go is that I wouldn't change my life for anything. I I sometimes feel a lot of pain due to my cerebral palsy. I'm also a cancer survivor, and I have arthritis, particularly in my knees and my neck. And the neck arthritis that I have is very, very debilitating. Sometimes I get very bad headaches because of the pain in my neck that shoots up right behind my right eye when it gets really bad, and sometimes It's to the point where I can't do anything. I have to turn off the lights, turn off my computer, turn off my TV, and just sit in the dark for maybe 2 or 3 hours until my pain medication kicks in my neck and my head feel better. But everyone, every human being on this planet has challenges. And we have good days and we have bad days. And I wouldn't change my life for anything. I wouldn't mind being a little taller if that was my, if I had a choice. Being taller would be good. And if somebody came to me and said, you could take this pill and the next day you would not have cerebral palsy or you wouldn't have to worry about cancer again, I probably would take that pill. But I know that pill isn't coming, at least not in my lifetime. So I want you all to remember that everyone has challenges. And you can't always assume that the people you meet are just the shells that you see. That there are layers and layers and layers beyond our shell. And getting back to my first point, if anyone from the federal government ever listens to this video, please pass on to Prime Minister Carney or the Liberal government in general that having a minister who can talk about some of these issues regarding disability inclusion and disability rights and disability fairness needs to be at the cabinet table. And if they're not, it does a disservice to us because our issues are unique and they're challenging, and we're not looking for special or unique rights above all other Canadians, but we don't want to be forgotten. And the historical reference I will give you is in 1982 when Pierre Elliott Trudeau brought the Constitution home to Canada and created the Charter of Rights and Freedoms. People with disabilities were originally not going to be included under Section 7 and Section 15. And these were the sections that spelled out certain groups that were going to be protected under the Charter. And people with disabilities were originally not there in the original draft. And the government of the day, which is the Pierre Elliott Trudeau government of the day, simply wanted to pass the Charter of Rights and Freedoms and get it into Canadian law as soon as possible. And they didn't want major amendments because they thought that if they opened it up to too many amendments, they could never close it. And so their strategy was to avoid any major change. And that included the inclusion of people with disabilities. And there were a lot of individuals that had to fight to get that in. I was 16 years old at the time, and quite frankly, as a high school student, I didn't really have a clear grasp of the Constitution or the importance of human rights for that matter. I was interested in, having my Duran Duran haircut and getting girls my own age to like me at the time, which I still have a challenge with, except that I've given up on the Duran Duran hair, which is, well, thank God for that. But these are the things that people need to remember, is that the fight for equality will never end in our community. And I realize that, but we have to try. And if anybody wants to ally themselves with the Canadian Disability Alliance, I encourage you to join. There'll never be a membership fee. I'll never ask for money because it's not about that. I'll never ask people to go against the principles. But if we can work together to improve the lives of people with disabilities across the country, whether you're disabled or not, whether you know a person with a disability or not, if you can help, we need to help. Thank you very much and have a good evening. Take care. Bye-bye.